All right, hello, good afternoon. My name is Alicia Phillips Mandeville, and welcome to the Interaction webinar on results-based financing. We're really excited to have you all join us today. I think we've got a great presentation, a few great speakers, and I think we'll really dive into some good context as well as examples of results-based financing. Just to set us up and give people a chance to adjust their sound settings, et cetera, let me give you a little context for the program and introduce our primary host. So this results-based financing webinar is part of a broader Interaction project on innovative financing for development with support from the Rockefeller Foundation. And that broader project is looking at a variety of types of innovative finance and really digging into what are the ways that nonprofit organizations can find themselves in the spectrum of non-grant-based financial mechanisms for trying to achieve social impact. So as part of that work, we looked at 17 different types of mechanisms, and part of our learning in the work to date, which has been about a year, is that it's really helpful to dive deep on specific mechanisms and really unpack them so that people can understand what they are, how they function, how they're structured, and start to understand the questions they would need to ask to see if that's right for their organization. So that's the background and context. We're looking specifically at results-based financing today, and I will want to, as quickly as possible, hand it over to Elena Sarkisova, who's been working with Interaction since the beginning of this work and has a broad range of experience with a variety of donors and investors and other actors, not just doing research on and surveying the types of mechanisms that are available, but actually diligencing some of the deals and being part of those transactions. So she's in a great space not only to help us understand how this works, but to give us some context for it as well. I'll also flag that Ben Bestor is on the line. He's the Interaction staff person who you probably were in touch with to set up this webinar. If you have any questions after it follows, please feel free to reach out to him. I think I'm also supposed to flag just that we do have a chat mechanism available through this GoToWebinar. As the presentation goes, if you think of questions, please feel free to chat them in. That way we can make sure to address them as we go. All right, so with that, Elena, I will hand it directly to you.
Thanks, Alicia. Hi, everybody. Thanks for the introduction. We have some great turnout today. I think about 70 people have RSVP'd, so clearly lots of interest in results-based financing, which is great, and we've put together a great panel for you today. So let's dive right in. So in case anyone has any trouble hearing or any kind of technical issues, please feel free, as Alicia said, to use the chat box as well as kind of submitting any questions around content that you have, as we built in 2 Q&As. So starting with just kind of a brief overview of objectives. So the objectives here are primarily to introduce Interaction members to results-based financing, how different instruments work, and how they might be used. And the focus, there's clearly a lot of different types of instruments that might fall under the results-based financing umbrella. And so we will touch on some of them, but really the focus is on performance-based contracts and impact bonds. Since those are the 2 kind of more salient mechanisms for Interaction members. The second objective is to expose the members to a number of practical examples of how other members are actually using results-based finance to improve program delivery and see how some of those transactions were actually structured, and then discuss some of the challenges and lessons learned. In terms of how we've broken up the next hour and a half, so basically I will just kind of rush through in 20 minutes, kind of giving you an overview of results-based financing 101. Then we will pause for questions for about 10 minutes, and then jump right to the speakers who will be presenting on specific examples. And then we'll also have another opportunity to take some of your questions and answer and hear from the panelists. So in terms of key definitions, so what are we really talking about when we talk about results-based financing? Results-based financing is fairly loose kind of umbrella term that is inclusive of a wide range of instruments that cut across many different dimensions and characteristics, but they all pretty much have one thing in common, which is that at least some portion of payment is tied to the achievement of pre-agreed results. And typically those results are independently verified. So at their most basic level, they basically focus resources away from things like inputs, processes, receipts, in other words, how money is spent, to outputs, outcomes, and impacts. So what is that money actually achieving? When we talk about instruments, we're referring to specific kind of RBF modalities or contracting types, so things like impact bonds or output-based aid. And in talking about what results-based financing is, it might also be important to highlight what it's not, given that it is such a wide umbrella. It's easy to kind of think anything can fall under it. But you know, so for instance, in this audience, many will have worked with donors like USAID that will build kind of milestones or targets into your contracts, which is obviously great. We certainly don't want to downplay the importance of that, but unless the money is dispersed against the actual milestones or targets, if the money is actually dispersed against budgeted costs, then it's technically not results-based financing, at least as we've defined it here. So why the interest in results-based financing? So we, clearly all work in development in some capacity. We know from personal experience, we know from the literature on this that activities do not always lead to desired outcomes. However, that is how the vast majority of social programs are actually funded. And that's a problem because there's clearly a huge investment gap to achieve the Sustainable Development Goals, somewhere in the order of $2.5 trillion. And second, funders, including governments, are facing increasing pressure to do more with less and justify the value of their social programs to various stakeholders, not least of whom are taxpayers. And so we're seeing a lot of that dynamic play out in the West. So by tying at least a portion of funding for social programs directly to measurable results, results-based financing offers a way to improve the effectiveness of existing programs. And it's for these reasons that funders are rapidly expanding the use of results-based financing, with nearly $30 billion committed in low and middle income countries alone in 2016. And that's up from about $5 billion in 2006, so just under 10 years ago. So in terms of how the basic idea behind results-based financing, so essentially what happens is an outcome payer and an implementing agency come together and agree on a desired result, so say reduced stunting among children under the age of 5. And then they also agree on how to measure success. So for instance, in this example, taking height and weight measures as compared to a historical baseline. And then they also agree on the price that the outcome payer will pay for each outcome. So say $50,000 for every percentage point improvement among a target population. Then the implementing agency will deliver interventions that are aimed at achieving that outcome among the target population. The results will be independently verified, and then payment is dispersed if and only if pre-agreed results are achieved. So one thing I want to highlight here is that this kind of separation of functions, namely independent verification and the autonomy of implementing agencies. These are kind of key characteristics of any RBF contract. So in terms of, as I mentioned previously, it's a results-based financing is a broad umbrella term, and there's lots and lots of instruments that could fall under this umbrella. Unfortunately, as you see here, this is a long list. We unfortunately don't have time to cover them all in this short webinar. So what I thought would be useful instead is to kind of highlight the key characteristics that actually distinguish these instruments. And if you're interested in learning more about each one and how it works, then you could refer to the annex later after the presentation, which we will be posting online, where we've compiled more detailed descriptions of how some of these instruments work. So the key characteristics really are who pays for the results, so who is the outcome payer, who delivers the services or the implementer, who assumes the financial risk if outcomes are not achieved, and basically what is the type of activity or what is the thing that actually triggers the payments. Is it outputs, is it outcomes, or is it impact? So for instance, in a conditional cash transfer program, which many of you, it's a type of mechanism many of you may be familiar with, any number of outcome payers, it could be donors, governments, NGOs, basically pay an individual or a household, so in this case the individual or the household would be the implementer, in return for adopting certain behaviors, like enrolling their child in school or getting vaccinated. So that would be the payment trigger. In what we call pull mechanisms, again, any number of outcome payers pay a private entity, so not an individual. It could be a corporate company or an NGO to basically develop a new product or service, for instance, a waterless toilet or a new vaccine. In results-based aid schemes, you typically have an international donor that will pay a national or subnational government for meeting certain targets, like enrolling girls in school or getting kids vaccinated. In all of these examples, the implementer is also the entity taking on the financial risk. But in other mechanisms, it can actually be a third party. So for instance, in a development impact bond, which we will talk about in more detail in just a few minutes, it's basically a private entity or NGO that is responsible for delivering the service, but it's actually a private investor who takes on the financial risk in case that service provider fails to achieve pre-agreed outcomes. So this list of instruments is certainly not exhaustive. There's new innovations happening all the time, and it's very difficult to keep track of all of them. But these are the ones that you will probably hear of most. And also, in terms of distinguishing characteristics, there are certainly other features that we can talk about. For instance, the total, what percentage of total payment is actually tied to results. That can vary significantly among the different instruments. And also the evaluation methodology used to actually verify success. So now turning to performance-based contracts and impact bonds specifically, so the focus of this webinar. So for performance-based contracts, the standard model doesn't actually deviate significantly from what I just described earlier in the last graphic. It's one of the more generic instruments, I would say, and can be adapted in many different ways depending on the context. So I'm not going to go over this graphic again, but it's basically any kind of contract between two legal entities, typically a donor or government and a service provider, or between two service providers, as Floride's example will show later in the presentation, where at least a portion of payment is tied to pre-agreed results. A couple of things I will say about performance-based contracts is the proportion of funding that is conditioned upon the achievement of results. So in other words, kind of the level of risk transfer really varies, but typically only constitutes a very small portion of the overall payment. The greater the portion of funding that is tied to results, the greater the risk for the implementer. And the option with the least risk is simply a bonus payment for the achievement of pre-agreed results. So essentially, all the money is dispersed up front, and then the implementer will get some kind of bonus payments for achieving certain results. And we see this quite often in the performance-based contracting space. Another thing I'll mention is that NGOs can play any number of roles, and Floride, one of our speakers, can probably talk a bit more about that. And performance-based contracts have been applied in a range of different sectors and contexts, but have become particularly prominent in health, again, for reasons that perhaps Floride can allude to in her presentation. So, social impact bonds. Impact bonds are very similar to performance-based contracts. Before I get into the graphic, I just want to kind of say some general things about impact bonds. And they were created in part to deal with an important limitation to performance-based contracts, namely the working capital issue. So as I mentioned, in a performance-based contract, it's typically only a small percentage of the payment that's actually tied to results. And there's a good reason for that. So if 100% of the payment were tied to results, where would NGOs get the working capital necessary to actually implement the programs? Most NGOs don't have the discretionary capital to be able to put it at risk, and even if they did, they probably wouldn't want to. And so in an impact bond, it's actually private investors who come in, provide the working capital, and then donors or governments will pay back the investors their principal, plus a financial return if desired outcomes are achieved. So basically, if 10% of the outcomes were achieved, then the investors will get one payment. If 20% of the targets are achieved, then they'll get an additional payment. So it's intended to kind of align all the incentives around the outcome. So in terms of how this actually works on a chart, just to kind of walk you through, so just like in a performance-based contract, typically an outcome payer and the implementing agency will come together, agree on the desired result, how they will measure that result, and how to price it. Then a social investor will come in, provide working capital and give it to the implementing agency to deliver services. The implementing agency will deliver the interventions aimed at achieving the desired result among the target population. Results will be independently verified. And then the outcome payer will pay back the investors their principal plus a financial return that is commensurate with results, if, of course, those results are achieved. So the key difference, so you'll hear social impact bonds and development impact bonds. They're basically the same thing, but there is an important, often misunderstood difference. So in a social impact bond, it's typically a national or subnational government or agency that is the outcome payer, whereas in a development impact bond, it's typically a donor, an international donor or private donor. And that's an important distinction because when it's a national or subnational government, the repayment to investors often comes from some kind of cost savings that accrues to the government as a result of the social program achieving its desired results. So for instance, reducing homelessness or reducing hospital visits. I mean, things like this actually save governments money. So they can use some of those cost savings to actually pay back investors. So it kind of makes fiscal sense oftentimes for certain issues. With donors, it's a little bit different because there's no savings per se. Donors don't have to spend any money in developing countries in the same way that national governments do. And so they mostly do it to kind of get more bang for their buck from a cost effectiveness or value for money perspective. But oftentimes the time and resources that are required to put it together can be significant and can be a deterring factor. And in practice, that's kind of part of the reason why we've seen such a proliferation of social impact bonds, but not development impact bonds. So as of August 2017, there were 90 social impact bonds that have been launched, whereas only 3 development impact bonds have been launched. The other point I will mention about impact bonds is because there is a higher kind of level of risk transfer, they are much more complex, much more time-consuming to put together because there's more at stake. And this is particularly true with regard to the evaluation methodology. So there tends to be much more of a focus on rigorous evaluation, so evaluation actually involving a counterfactual situation. So randomized controlled trials, quasi-experimental methods tend to be kind of preferred. And that's to ensure that investors get paid for results and that outcome funders don't actually pay for something that would have happened anyway due to external circumstances. So the benefits to, so why would you do this? So the benefits to the outcome payers are pretty clear. They get to outsource the risk and pay only for results. That's great, but what's in it for you, kind of the implementing agencies? So there's 2 primary benefits. So one is around improving impact, and the second is around expanding funding prospects. So in terms of improving impact, there are there are many factors that can drive impact, but there's kind of 3 main ones. So one is around improved data tracking and measurement. So paying for results requires investing in things like data systems and also regularly tracking results. So RBF can give implementers sort of that continuous feedback on their performance, which can drive impact. The second is multi-year funding. So achieving results obviously takes time, longer certainly than things like performing activities. So paying for results requires donors and implementers to kind of take the long-term view. And the third is around flexibility in program implementation. So RBF basically tightens control over achieving results, but allows greater flexibility in how programs are actually implemented and offers kind of more space for that adaptation, iteration, and innovation. And the second major benefit is around expanding funding prospects. So organizations that engage in results-based financing look more competitive to donors. So if you can demonstrate that you can achieve results, donors are more likely to support you over other organizations. And they're also more likely to attract new, more risk-averse donors. So donors that perhaps wouldn't have otherwise been able to support a program because it's more risky, and thus open up new funding opportunities that way. I think a lot of people, when they see impact bonds and they see social impact investors, they think it's new money. Oftentimes that's actually not the case, because it's still the donor who has to pay back the investors, so it's actually just a different way of channeling that money. Although it could be new money if the program fails, because then the outcome payer doesn't have to pay. Lastly, RBF is clearly not a panacea. A lot of things have to kind of fall into place for it to be for it to work well. Contracts, for one thing, can have to be well designed. So one risk is, of course, that you kind of focus on the wrong result and actually detract away from the long-term goals of the program. Another risk is that around like financial incentives. So financial incentives could be insufficient to affect the implementer's behavior, or worse, crowd out other important kind of intrinsic incentives among implementing teams. So you have to be very careful that sort of the incentive structure is well aligned with the mission of the organization, what they're trying to do. And then lastly, too much flexibility can obviously also be a bad thing. So you have to be you have to ensure that the scope is properly bounded. And then the second major challenge around results-based financing is that it's not really well suited to all development problems. So some problems are going to be more amenable to the RBF structure than others. And kind of the sweet spot for RBF is when you know the result you want to achieve, and that it's clearly defined and measurable, but you don't actually know how to get there. You don't know what the right mix of activities and inputs is that will actually lead to that desired result. And so there's that benefit to transferring risk to providers to create that space for adaptation and iteration. So one example might be malnutrition. We know what we want to achieve. We want to reduce malnutrition. In health in particular, there's clearly defined metrics around how to measure things like malnutrition, but we don't necessarily know what the right mix of activities and inputs is. So it could be behavioral, cultural factors, it could be hygienic practices, it could be access to food. We don't really know what the right mix of interventions is to actually reduce malnutrition. So that kind of wraps up the results-based financing 101. I hope it was clear, but let's pause there and see if we have any questions that have come in. So let me just review for a minute what kinds of questions are coming in. So it's one question. So one question we have is, in the RBF scenario, what are the assumptions around how the implementing partner will deliver interventions to achieve the results when the payment is only delivered once outcomes or impact are achieved? So I think one of the benefits of, if I'm understanding the question correctly, one of the benefits of RBF is actually that it provides, as I said, it kind of tightens control over what the result is, but it actually gives service providers a lot of flexibility in terms of how they allocate resources once the program is launched. That's not to say that providers don't need to have a plan. A lot of work goes into kind of the operational plan. How will you achieve the results? What is your theory of change? But once the program is launched, if things come up that were unexpected, there's quite a lot more flexibility in how you can actually reallocate resources or divert attention from some activities and redivert it to other activities than under traditional funding mechanisms. So the other question was, what is the international experience of combining RBF with other non-financial incentives? So social, moral, and other incentives. That's a good question. And I think actually one of our speakers, Floride, I think she might have some comments around that. I don't know about moral or social incentives, but certainly there are variations of performance-based contracts where it's not just financial incentives, it's in-kind incentives and other types of incentives. So perhaps we can park that question and see if some of the speakers have any insights to add to that. So we'll wait maybe one more minute to see if any other questions come in, and then we will jump straight to the speakers. You've made my job easy. All right. Well, I think we can keep an eye on the inbox and see if people, we will have another opportunity to do a Q&A at the end. So for now, let's just move right along. So our first speaker is Floride Neuier. And she is a principal technical advisor working with the Management Sciences for Health. She provides technical expertise to performance-based financing projects, health system strengthening projects, and capacity building of local staff. She has over 20 years of experience in public health, clinical practice, and medical research, extensive experience working in both developing and developed countries, and before joining MSH, she worked with the World Bank in Washington, D.C., where she supported developing countries implementing performance-based financing. And prior to that, she worked on the response to the H1N1 epidemic with the Virginia Department of Health. And she actually started out her early career as a practicing physician. And she's going to be talking today about the DRC Integrated Health Project. Oh, and just as before I turn it over to you, Floride, so just to give people context, so what I've asked the speakers to do is to present sort of on the context. So what is the social problem or development challenge that they were trying to tackle? What was this? Why did you decide to apply the instrument that you did? Why did you think it was particularly well suited to the challenge at hand? What were the results, if there are any? And sort of what are the key takeaways or recommendations that they would give to organizations who are exploring this type of instrument? All right, over to you, Floride.
Oh, thank you for the nice introduction, and thank you to all who chose to spend the last hour and a half listening to us. So for some of you who may be wondering who is MSH, Management Sciences for Health is a non-profit organization. We're dedicated to saving life, improving the health of the world's poorest and most vulnerable population by building strong, resilient, and sustainable health systems. As such, we've been around for over 45 years now, have worked in 150 countries. We partner with government, civil society, private sector, and health workers from all kinds of work and all levels. And that probably leads me into the topic of today's interest, the performance-based financing. This approach actually has been around for some time, but it only picked up the interest in health over the past couple of years, probably the last 10, 20 years. As of now, there are, for example, 7 countries in sub-Saharan Africa that have scaled up nationwide performance-based financing. About like 12 countries that have big pilots exploring performance-based financing, and then 17 considering. That's just in sub-Saharan Africa. And when you look outside of the African continent, you have countries like Cambodia, Afghanistan, Haiti, Indonesia, and so forth, exploring performance-based financing. But why this approach caught the interest of implementers? I think Lina was touching a little bit on most of this. We're working in a resource-constrained environment, and we're always trying to figure out ways of doing more with the limited budget. And usually when people start looking around on how to address challenges, they turn right away to we need more money. However, when you look at how the existing funds, for example, are being used, there are a lot of documented study that shows that 20 to 40%, for example, of budget dedicated to health in many poor setting developing countries are actually wasted. Whether it's inefficiency in the system, or people missing work, or people being just not motivated to go to work. And so then you're trying to increase the budget, but you're not solving the underlying causes. So at some point, there were people who started trying this approach of bringing the attention to achieving the intended outcome, and trying to do it in a cost-effective manner by focusing the attention to achieving like really defined results. So that's how it was initiated in health, and it has proven to really assist in tackling some of the challenges, like motivation of personnel, more increased drive for achieving results, and improving the quality of services. As an organization, I did mention earlier that we worked with government, civil society, private sector, and ministries of health. And we have played multiple roles when it comes to performance-based financing. Alina earlier on was going through the different key players or roles. I can say that we have played almost all roles, depending on the context, where we were the implementing agency. In some other places, we were the payer. In some other places, we were conducting the quality verification or evaluation, as characterized under this presentation. Just to not confuse the audience, we selected to use one country example so that we won't be talking to many roles played in different contexts. And that's how we decided to share the example of Democratic Republic of Congo, where we implement a big project, integrated health project. Under the arrangement, the project is funded by the USAID and managed by us, Management Services for Health. The implementing partners is different level of the system. In DRC, for example, MSH contracted 7 health zones, 7 referral hospitals, and 118 health facilities. These are the implementing agency as characterized in this presentation. And then for the evaluation, MSH and the regional health authority. I'm just assuming that we're all familiar with the health setting where you have the central level and then followed by the regional and then the zone. In some instances, it may be the district, and then the health centers at the lower level. So in this instance, MSH contracted the health zone, the referral hospital in the health zone, and then the health centers. Whereas for the quality verification, MSH and the regional health authority conducted the quality verification. This project was evaluated by external evaluators, mainly the Kinshasa School of Public Health and the International Business and Technical Consultant Group. The regulation in this kind of setting, when it has to do with health, is usually done by the Central Ministry of Health, and that was the case in DRC. They are the ones setting the standard of care, the package of services that has to be offered for the hospital, let's say, and for the health centers. The project was implemented between 2013 and 2016. The total investment was around 31 million. The target population covered by this project was around 12 million. In terms of how the disbursements are made, they're actually triggered by the implementer achieving the set target for different indicators. And so indicators has to be clearly defined, and they have to be specifically tied to the person performing the action. I mentioned 3 levels of implementing partners. So each one of those levels, they have to be matched with indicators that are tied to things they can influence. Basically, what I'm trying to speak to is indicators that are specific to the person performing the action, indicators that can be measured and specific and realistic in time. Something that is not so easy to achieve, but yet achievable within the agreed upon time. So in this case, we have supervision and management indicators. Those were the health zone were held accountable for. We have quality indicators. We have quantity indicators to which the service provider were held accountable for. And then for the payment mechanism, we used an upfront capital investment that was determined by a baseline need assessment. Alina, she touched on it a little bit earlier. You basically, because of the nature of the business, this is health provision. You can't really put too much risk on disrupting the service, and you have to guarantee a minimum functioning of, should I say, optimal functioning of the facility, and yet hold the facility accountable for certain measurable targets before you can give the additional funds. So that's how we proceeded with the payment, an upfront capital investment, and then subsequent payments tied to achieving targets per each indicator. In terms of the evaluation methodology, I mentioned this earlier, MSH with the regional Health Authority conducted quality verification, and then the impact evaluation was done by external evaluator. Can you move to the next slide? I wanted to share a little bit some of the results achieved through this project, and maybe I should have spoken to the challenge we wanted to address, which basically aligned to those I mentioned earlier on why people got interested in performance-based financing. But in the particular context of DRC, for example, there was an index of operational capacity to offer quality health services. It's called SARA survey, which was conducted in 2014 and showed that this index was only 27%. And then the country was also dealing with low motivation of health workers, poor quality of data that is incomplete, inaccurate, and not available by defined deadline. So under this mechanism, these are some of the preliminary results that we were able to achieve. In terms of the client satisfaction, basically the patients, this is a survey that was conducted by a civil society organization contracted by MSH. They actually determined that this satisfaction rate improved from 75 to 86%. And then the quality of care as measured by the metrics we set improved from 33% to 73% in RBF supported facility, whereas in non-RBF facility, it only improved by 20%. Likewise, the rate of discrepancy in the data reduced from above 40% to 10%. In RBF supported facility, we saw an increase of people using curative services compared to non-RBF. And so the motivation of the personnel was likewise improved. And we also saw an improvement in the staff personal satisfaction. And maybe I can tie in here one of the pending question that came through the chat on the moral and social incentive. I think it is known that all of us, not just the health workers in poor setting context, we all are motivated by intrinsic motivation and extrinsic motivation. So what this PBF does, because it by improving the working condition at the health facility and then allowing health workers to be more performant, it gives them some level of personal satisfaction because they can do more work. They can it's almost like the satisfaction of a job well done. I'm sure we've all felt this way when you have a challenging task and you got it done, especially in health, you save someone's life. It's really a motivation. So by improving the working condition, allowing them to provide the services in improved condition basically is a motivation by itself. And then for the RBF incentive, some of it is reinvested in the facility. An extra percentage is reinvested in staff motivation. They basically get a small bonus for achieving the target as a team. And that plays to the extrinsic motivation, basically appearing to both. In terms of, I think there was a question on the moral I'm not sure if it was a moral distortion or something. If careful monitoring is not exercised, there could be a neglect, for example, of non-incentivized indicators. So there is a need to closely monitor the incentive. There is a need to adapt and change as targets are met and new challenges are emerging. So basically, a need to constantly be one step ahead and use the limited funds to achieve, to constantly achieve more. I would probably stop there. I'm not sure I've gone over my 10 minutes and see if we have more questions for me.
Yes, thank you, Fleury. That was great. We do have, I certainly have questions, and then we do have one question. I'm just thinking, in the interest of time, perhaps let's go through all the presentations first, and then we'll come back to the questions. So everybody, please, if you do have questions for Fleury, please continue to submit them through the chat box, and then we will get to them. I don't know if people are. Okay, so our next speaker is Caroline Bernardi. I know we had some issues connecting her earlier. So Caroline is Senior Director of Institutional Giving at Village Enterprise. She joined the team in 2005. And prior to Village Enterprise, she worked in operations and finance in the luxury goods industry in France and was co-founder of Matiam, a social venture. And she's going to be talking about the first poverty alleviation development impact bond in sub-Saharan Africa. So Caroline, over to you.
Yes, good morning. Thank you so much for having me on that webinar. As Elena was mentioning, I work for Village Enterprise. And for those who doesn't know us, we work with the poorest people in rural Africa and provide them with a sustainable path out of extreme poverty. Village Enterprise has 30 years of experience working with the rural poor in East Africa, and we implement a one-year graduation program out of extreme poverty where we provide seed capital, training, mentoring, and formation of business savings groups to mostly women living in rural villages. Right now we operate in Kenya and Uganda, and this year alone, for example, we will start 4,400 small businesses across Kenya and Uganda, and we will train 13,000 people. And so the problem that we're trying to, to tackle here is, to lift those 7 million people who still live in extreme poverty, and 400 million are in sub-Saharan Africa. And so the definition of extreme poverty is defined by the World Bank as people living under $1.9 a day. And the goal of the United Nations and the World Bank is to end extreme poverty by 2030. But in order to do that, and achieve that goal, there's a need to attract new sources of funding and capital to make sure that we can, lift all those people out of extreme poverty. And this is why Village Enterprise decided to embark in that development impact bond, basically to create a proof of concept for cost-effective and scalable adoption of extreme poverty alleviation program. And so we were selected by Instiglio, who is a nonprofit organization based in Colombia that specialized in RBF mechanism. So we were selected among 80 potential organizations to create that proof of concept and implement an evidence-based innovative funding mechanism for poverty alleviation. A couple of reasons why we were excited about this project and why we decided to move forward with that is that we had positive and rigorous results from an RCT that we had conducted in Uganda with Innovation for Poverty Action, and so we were confident that because we had that very strong evidence that we could basically replicate that and through that development impact bond. And another thing why we were interested in embarking in that project is that it enables us to attract basically new private investment capital that we would not be able to attract otherwise through like traditional grant making and receiving more traditional grants. And so the structure of this development impact bond, so this is a $5.3 million project, and $4.3 million is committed to outcomes. The outcome payers of that project are an anonymous philanthropic fund, as well as USAID Development Innovation Venture and DFID. The way this development impact bond was structured, they created an outcome fund, and the trustee of that outcome fund is the Global Development Incubator. And why they did that, it was again under that premise that this is a demonstration project that hopefully, if successful, could be scaled, by having other outcome payers, coming into that mechanism, other service providers in poverty alleviation, embarking in that type of result-based financing mechanism, and then other investors coming in. So this background was structured, to be scaled if successful. In Stiglitz,
Hi, Caroline. I think we're losing you a little bit. Seems like to be maybe some wind or maybe something with your microphone.
Can you still hear me?
Yeah, that's great.
Oh, it's better. Okay. And so we have right now. So we're like at the very beginning of the project. I mean, the design and structuring have been done, but we're still looking for impact investment. We have like 1 million committed, and we are looking for another 1.5 million. In that deep, as opposed to other maybe more traditional structured where there is an intermediary that play the role of raising the working capital and the investments, Village Enterprise here contract as a service provider is also contracting directly with impact investors. And so we're right now in the process of kind of, developing and that structure to be able to receive different type of investments, both recoverable grant or debt type of investments. So we will set up an SPV, to be able to do that. So to get into more like the target outcomes and the measurement framework, so the goal of the payment metric is basically to closely tie the ultimate impact of our program, to the outcomes, and so for that we are rewarded on improvement in income. And through this, to be able to do that, because measuring income in poor low context is very difficult. We're using consumption and net asset as the proxy for the increase in the income of the small business owner we're working with. And those results will be compared to the one of a control group. So there's a randomized control trial embedded into the project that will be conducted by ID Insight. And the payment formula follow closely the theory of change of village enterprise, to create small sustainable businesses and increase the income of the small business owners we are working with. And so it's basically, so they're going to be like two payments. So one will be tied to the validation of the cash transfer that we're providing to the small business owners so that they can start their small business. And the second payment will be tied to the increase in consumption and net asset. There will be so this project is a 3.5-year project, and there will be 2 outcome measurements throughout the project. So as I said, like in terms of key takeaways and results, we don't have many yet because we are very much into just starting the implementation. We just started the implementation actually 2 weeks ago. And so, but some key takeaway that I could flag right now is that, the designing and the structuring of the project, even though it has been an incredibly interesting and rewarding experience, has been a very, very long one. It took us over 1.5 years to design the project, to raise the outcome fund necessary, and we're still in the process of raising the investment capital for for the working to have the working capital to implement the project. So that has been a very long process. One key aspect of the implementation of the development impact bond is that you want to make sure that as you're implementing your program, you're on track to achieve the expected outcome. So we've been working at strengthening and streamlining our performance management system, and that's this is one key aspect of the project. One other aspect of the project that we're excited about is that it enables us to integrate innovation, and it enables us to have some flexibility to adjust our programming for increased cost effectiveness and impact. And another and last takeaway that I would say is that in order to implement a development impact bond and structure that, you need very strong legal and accounting expertise to make sure that you're setting it up right. And so we were very fortunate to have some pro bono legal expertise and accounting expertise. But this is something that, as a service, as a small organization, you may not have in-house, and that you should consider. So yeah. So I don't know if anyone has questions.
Yeah, thank you. That was great. So again, lots of questions, I'm sure, and I certainly have questions. But I guess in the interest of time, let's move on to our third and last speaker. We tried to be a little bit more risky, and basically, so instead of showcasing another case of how a project was successfully designed or implemented or launched, we decided to go with kind of a counter argument. So basically, our next speaker will present on an example of when an impact bond idea went through some feasibility work, and then basically they decided not to proceed with it. So we will be hearing from Abby Bassin, who's the Vice President, Chief Financial Officer of Global Communities. And at Global Communities, Abby is responsible for managing the finance, accounting, grants, and management functions. He also provides strategic guidance on investments, along with conducting due diligence on investment and merger opportunities. He also provides guidance on donor compliance issues, and before joining Global Communities, Abby was the Chief Financial Officer of Crew Cuts in New York. So over to you, Abby.
Thank you for the introduction, Alina. And thank you, everybody, for letting me share our experience with the development impact bonds. As Elena mentioned, I'm going to talk a little bit about why this wasn't the right mechanism for our organization, but by all means, we've heard some good examples on the contrary of some of the other experiences there. So let me just dive in and give you a little bit of background of what we were trying to accomplish and why we chose not to proceed with this. We were working in the Middle East region, Middle East and North Africa region to implement our youth empowerment strategy. Basically, the goal of the program was to reduce the unemployment, the extremely high unemployment rate in Jordan, Lebanon, and Egypt, the three focus countries for us. And furthermore, we were trying to target not only the underserved, so the disadvantaged youth, but also women population across those three countries. So we had funding through a private corporate donor, and it was coming to an end, and we were really happy with the results of this program, so we wanted to continue this work out there in the region, and we were discussing about exploring various ways of funding this further. We already had a lot of federal money in the region, so looking for federal funding wasn't an option at that point. So we started exploring an investment bond opportunity, impact bond opportunity. We thought it was a good program to try to achieve this because it was a very measurable program. The goal was really to align the employers and the training providers with job seekers. So once you get those three various entities to focus on what the employers were looking for in terms of the jobs they had to offer, but also adjusting the training curriculum for these private trainers that they were offering. So, you know, we thought that was a good program that we can sort of go with a development impact bond on. So I'll jump into the challenges that we seen as we were talking through these mechanisms. One of the biggest challenge, and actually it developed over a course of multiple months here, is the alignment of desired results. So we were working with an investment firm who wanted to work with on this bond with us. We felt that the program should be measured on the basis of number of individuals trained through this curriculum, but they felt that that wasn't necessarily a great outcome of the project, and they actually wanted to sort of gauge results on number of individuals we were able to place in private companies or various other opportunities that they may have in that region. So a couple of challenges with that. While the outcome was certainly measurable in this case, we felt that some of the components of that was outside the control of our ability to make sure the outcomes were aligned here. So, you know, job markets are several factors, changes in needs of employers another factor, some things over there that we just couldn't control. So we couldn't really align what the ultimate goals of this development impact bond would have been versus what we were able to do under the program that we were implementing then. So that was one of the bigger issues that came up. Cost commitment. You heard the previous presenter talk a little bit to this. As an organization, developing a bond from the start required quite a bit of time commitment from our employees and management. So I can speak the role I played throughout this process. Myself, I was engaged in multiple conversations with our partner to try to establish this bond. So it took, you know, approximately 40+ hours of my time alone over a 3 to 4 month period. But outside of my time, there were at least 7 to 8 other individuals within our organization that were involved throughout this process. So, you know, you have to take that into account. There's going to be a time commitment on you and your staff when you're trying to engage in something like this. Another factor that came into play was the actual cost of developing this thing. So outside of our employees' time and management time, which we could contribute towards this, was the actual dollar amounts. So the investment partner that we're working with basically wanted to get paid to help us develop this bond, which is understandable from their perspective. You know, working in finance, I'm not faulting them for that. However, the cost of that seemed fairly excessive to us based on the overall value of the bond. So just to throw a few numbers behind this, we were looking at a program that was approximately $5 million over a three-year period. But after factoring in the time commitment of our own staff plus the actual dollar amounts that we needed to contribute to develop this stuff, it quickly became very inefficient from a perspective. The cost benefit wasn't there for our organization to pursue this further. Another challenge that we had was basically the organization changes that were required to develop this bond. So we're one of the larger implementers of federal government, similar to MSH that the speaker spoke about a little bit earlier. So we already have quite a bit of infrastructure at Global Communities. So we have M&E teams that sort of monitor our program's progress. We have IT, HR, finance, various other functions that are sort of ingrained as part of the organization. So one of the early conversations we had with our investor was the fact that they wanted to see where they can create further efficiencies within the organization. Driving efficiency is somewhat a code word for they need to restructure how we operated the organization. So that's a little bit of a difficult conversation for us to engage in, to sort of have outside perspective on how we need to modify how we handle and manage our programs, which sort of wasn't really a good thing at that point for our organization. So that was another reason why we didn't think that this was a good option for us. But ultimately, the biggest reason behind why we didn't pursue this, Elena's explained to everybody a little bit of how this thing is structured. So there are, at any given time, 4 to 5 parties who are engaged in this process. So ultimately, we felt that through this mechanism, it was somewhat moving away cost from our beneficiaries to the investor who's absolutely taking a risk, but they need to be paid for that risk. So some of the costs that could be utilized ultimately to provide a benefit to our beneficiaries was sort of getting diverted to not only the investors, but also external entities that had to monitor the program from a financial and technical perspective. So from our organization perspective, it felt like the amounts of monies that are available to be directed towards beneficiaries were somewhat reallocated to a certain extent to the investor who was taking the risk, but also independent evaluators who had to evaluate that we were achieving the goals of the program itself. So real quickly, that sort of summarizes some of the reasons why we didn't go with this thing. I could go into certain other things in terms of the microstructure and things like that, but I'll stay away from it unless there are some specific questions, because there's a whole different aspect to it on how our indirect rate structure sort of has to be applied consistently throughout various contractual mechanisms that this organization is undertaking. So that was the last complicating factor, but I'm not going to necessarily get into it unless there are specific questions on that.
Thanks, Abby. Do you have any kind of takeaways for people who are sort of exploring this mechanism?
Sure. From my perspective, I mean, again, the takeaways are know what you're getting yourself into. It is a relatively long process from having a conversation about your organization interest in development impact bonds to actually creating a development impact bond. That itself could be a fairly long process. From our experience, we sort of gave up probably in month 5, and at that point we were not able to even come up with the actual metrics to evaluate the program itself. So there were several other steps after that in terms of identifying an investor and also in identifying a donor to fund this activity itself. So keep a timeline in mind, because it's a fairly long process. And second, I mean, depending on the size of the organization, I would say that smaller organizations are a little bit better suited for this type of instrument, just because they don't quite have that infrastructure and controls and policies and procedures established to sort of do things their own way, whereas they can experiment to a certain extent with various other mechanisms on how to monitor a program or how to implement a program, because that's another thing that was a little bit of an obstacle for our organization to pursue with this. Those are some of the things I can mention here.
Thank you, thank you. So before, we do have some questions, so before we get into the audience questions, I was actually going to see if Caroline, you had anything you wanted to add or kind of respond to based on what Abby said. particularly around sort of the cost implications. I mean, obviously, Village Enterprise is a smaller organization than Global Communities, and so kind of how the cost-benefit analysis played out in terms of your thinking, and whether, I know, Caroline, in your presentation, you touched on some of the sort of non-cost benefit analysis benefits to doing an impact bond, so kind of the learning, and so sort of how that factored into sort of your thinking, and specifically what learning could be generated through an impact bond, even if it doesn't, in the end, make financial sense to do it.
Right. I mean, for us, one key, appeal for this development impact bond was also, as you're mentioning, the learning opportunity, and what, because of the randomized control trial that will be embedded into the project, what we will be doing is testing two different sizes of cash transfer, seed capital, to our small business owners. So right now we're providing our program, we're providing $150 for a group of 3 business owners to start a business. But this is, like, compared to other programs across the graduation industry, it's a very small amount, and so we will be testing as well through that development impact bond, like 3 times that cash transfer, so $450 for a group of 3 persons. So that was one aspect for us that we felt compelled, to do through the development impact bond. And also one thing, I think as Abby was mentioning, like, we're a smaller organization, and we believe that as a small organization, the way you can, have a large impact and contribute to the sector, and for us it's poverty alleviation, is by, being able to maybe take more risk and, and contribute to the learning of the sector as a whole. And this is why we were very keen on doing that development impact bond. But it's true that in terms of, it has been a huge opportunity cost. There's like trade-offs when you're embarking into such a project. And, for me, for example, over the last year, I think it has taken, maybe, I would say 50 to 60% of my time, and so that's like 50 or 60% of the time that I'm not dedicating to pursuing other type of funding sources and grant writing. So it's true that it has there's some opportunity. Opportunity cost analysis to do when you're embarking in such a project.
Great, thank you. So we do have some questions from the audience. I think the first one we got was actually for Floride. So it was around maybe kind of going a bit deeper into sort of your role vis-a-vis USAID, and also your role vis-a-vis the implementing partners. So in terms of the implementing partners, kind of what was your role in terms of, like, were you providing oversight or technical capacity building or performance management? And then with regard to USAID, so the question is, was this a grant to MSH by USAID, and then MSH paid their partners based on the results, or kind of a better understanding sort of what your role was vis-a-vis these 2 partners?
Thank you. Thank you for the question. In terms of our role vis-a-vis from USAID, this was a cooperative agreement awarded through a competitive bid. If some of you online have, I'm sure you're doing business with USAID. It's either a cooperative agreement or a contract. And in some instances, it's a grant, but this one was a cooperative agreement. In terms of the relation, what was MSH role as compared to the 3 implementing partners? We contracted them for a set of deliverables. So that was, I mean, in short, that was the relation. In addition to contracting them, we provided technical assistance in regard to implementation of the performance-based financing, like designing the scheme, training the different actors, developing the tools for standardized implementation. I did mention it's over to more than 120 institutions involved, and you want the implementation to be standardized. You don't want people to be creative, so you have to develop the tools, develop the manual so that you can do a standardized implementation, and then in between provide the coaching and mentoring. For example, after each quarter, when you do the verification and the findings are obvious, so that's basically used to inform the discussion with the different implementing partners, a discussion that is kind of so these were the target and you did not achieve, you underperform. What were the challenges you encountered? How can we work together so that we can next time around achieve or surpass the target? In cases of places where the implementing partners met or went beyond the target, we still want to understand why. What was the innovation you used so that we can learn from it or share with other implementing partners. Hopefully I answer your question. If not, please let me know. I will clarify.
And just a follow-up question on that, did MSH have any skin in the game? So did were you paid based on a performance, based on a results-based financing scheme, or was it only at the provider, like the provider level?
No, MSH was not paid through the PBF. So it's a cooperative agreement with USAID, and there was no such performance-based financing mechanism between MSH and USAID. However, we used the performance-based financing mechanism to make sure we're achieving the targets with the implementing partners.
Okay. And then if targets were not achieved, so would USAID basically take back that money, or I guess would USAID hold that money, that outcomes or results-based financing money until the targets were achieved? And if they were dispersed, if they were achieved, then they would disperse those funds directly to the providers?
So the funds are actually entrusted to MSH. And MSH is the one managing the funds. So in case of funds, let's say the targets are not met, between the implementing partner and the fund holder, in this case MSH, there has to be pre-agreement on how unused funds will be reallocated. It could be in making sure, for example, underperforming facility are given a little bit extra attention, but it's usually agreed upon upfront.
Right, so it's not that USAID would take the money back, because I know that can be problematic for a lot of donors from a legal compliance standpoint.
Correct, yeah.
Yeah, interesting. Okay,
and just to add to some of my colleagues, when you were asking about the cost effectiveness, I think the question has been also going around with performance-based financing. I did mention some up to 7 countries who are now using this mechanism as a national approach to delivering health services. And some of this question came up on the cost effectiveness, the sustainability. For example, in terms of using an external verifier, such as an NGO, NGO are building capacity of the locals so that an independent verifier role can be entrusted to a local NGO. And MSH is actually playing this role. For example, in Haiti, we're working as a verifier, and at the same time we're building the capacity of the locals so that they can take over in few years from now. And that will be more cost effective. And there are some schemes that have really costed a lot because the incentive was set too high. And when it's set too high, you know, people work harder. But at the same time, the question of sustainability is a legitimate question. If it's too high, is it sustainable? And if then it's not sustainable, what is the appropriate level of incentive that can motivate the health workers and yet be sustainable in the long run?
Great, thank you. So we do have another question, and that's for Abby. And actually, somebody did want you to expand on the NICRA point. So we do have more of a technical, financial background audience today.
All right. You know, as part of the NICRA, one of the issues that we generally tackle with, not just with Development Impact Bond, but also with other donors, be it World Bank or UN organization or UN entities, is that we have to apply our indirect rates consistently across the board. And one of the challenges while discussing with the investor in terms of developing this bond was the fact that they wanted to drive efficiencies, quote unquote, within the organization, basically trying to reduce the indirect cost of our organization. But that's not something we can do because we have to apply whatever our indirect cost structure is consistently across all our donors, especially since our federal donor is greater than 50% of our work. So, you know, that sort of also created some issues early on into the conversation while discussing this stuff. Not to say there's not a solution to this, but that's something that was hard to explain to a potential investor why consistency really matters when it comes to federal grant making. Hopefully that answers that question.
Great, thanks, Abby. So we don't have any other questions from the audience. I guess, so we have about 5 minutes left. I was just going to ask maybe Flory to, oh, we did have one more. Oh, okay, so it's actually for a question for Florid. So can you talk about the NICRA implications in the context of your program? Did that ever come up as an issue?
No, really.
Can I answer that real quick? Sorry.
Yep.
It shouldn't come up under their mechanism because ultimately they received a cooperative agreement from USAID, so they're receiving everything. What they're actually doing is they're partnering up with local organizations to do the results-based financing, which is quite a bit different than a development impact bond. So two completely different sets of contractual agreements altogether.
Yeah, good point.
And thank you, Abby.
Sorry to jump in on your question.
No, that's okay. You helped.
All right, so we have about 5 more minutes left, or less, I should say. So I was going to just refer people to some resources in case, you know, like I said, we did compile some more information about specific RBF instruments in the annex to this presentation, but we've also pointed to some additional resources. So Brookings has been putting out a lot of work around impact bonds. So they have 2 deal books that they've compiled in recent years. So one around early lessons around social impact bonds around the world, and then they've recently launched a deal book on impact bonds being developed in developing countries, so early learnings from the field. Even though there's only 3 that have been launched, there's actually, I think, about 40 that are in the process, kind of in the pipeline, so they talk a little bit about those deals. So those are great resources. I know Brookings it also has a database that they're working on that they potentially will put on their website at some point. And then there's also a few practitioners' guides just around results-based financing more generally. Feel free to continue if you do have any questions, follow-up questions that you thought of later on, or if you'd like to stay engaged with interaction on these issues, then please be in touch with Ben Bester. So his email is included in the PowerPoint. So there's a listserv I know that they have going on for the private sector working group. And so, in case there are future events like this, then you can be in the loop. So with that, I think we will wrap up. Thank you so much for all the speakers. I mean, this was a wonderful exchange of ideas. Hopefully it was useful for the audience, and have a great rest of your week.
Thank you, everybody.
Thank you.
Thank you.
Thank you.